afternoon, Puan Rohaini and my dear friends. I'm going to be presenting about my community service activities, the topic was community service disaster drill, which is flood incident at Bukit Tinggi, and my subtitle was patient transferred to Pantai Hospital Klang. My team members was total 5 persons, which is in the main role, who are the Dr. Kamil, which is Chief Medical Officer, and myself, Emiko Magel, and SSN Bakia, SSN Emily, and SN Akmal. My introduction today for this topic is goal, highlight the importance of disaster preparedness and a coordinated medical response. The activity is simulated flooding scenario at Bukit Tinggi, leading to patient transfer to Pantai Hospital Klang. Our patients was transferred by St. John Ambulance staff with 1 driver and 1 paramedic. Our focus for today is emphasizing teamwork, effective communication, and community engagement in life-saving effects. Highlight what the contributions of doctors, medical assistants, nurses, and volunteers in fostering resilience and readiness. Community service information. Name of activity is flood incident disaster drill, patient transfer to Pantai Hospital Klang. The date was 19 November 2025. Day was on Wednesday. Time was 3 p.m. to 5 p.m. Venue was Bukit Tinggi, which is the disaster site, and Pantai Hospital Klang was the receiving facility. Targeted community or beneficiaries, flood victims in need of immediate medical assistance, hospital personnel, and the local community gaining from enhanced disaster readiness. Participants' roles and responsibilities. First, triager, who is senior staff nurse Bakia, who have to manage the triage process, coordinate the patient's transfers, and ensure communication with command center. So, this picture's been shown. Triager was SSN Bakia, who have to triage the patient upon arriving and tagging to the patient according to which zone. Okay, second is mine, which is I'm in charge of the red zone. So I need to assist patient movement and ambulance coordination, deliver first aid like wound dressing, bleeding control, and oxygen support, document patient info and update the command center, provided emotional support to distressed victims. So these pictures has been shown. I myself with my team. So we are taking vital signs for the patients and do the necessary things for the patient. And then second zone was yellow zone, which is in charge by staff nurse Akmal. He have to do supported patient movement and logistics, administer first aid and oxygen therapy, recorded details and prepare handover notes, and reassurance anxious victims reported psychological needs. So, in the pictures showing Akmal doing the clerking notes, which is documentation. And the third zone was green zone, in charge by senior staff nurse Emily. Same as well, manage minor injuries and patient movement, conduct wound care and bleeding control, documented cases and update command center, offer reassurance and psychological support. So, in these two pictures showing, Emily is in charge of green zone. So it taking the vital sign during and then doing documentation as well, and then he reporting the patient's condition to doctors as well. Last but not least is command center, which is the main hub for communication and coordination. Receive updates from all zones, ensure accurate patient tracking, resource allocation, and smooth transfer to Pantai Hospital Klang. This red zone and green zone and yellow zone staff must inform the command center once receive the patient's current condition, what is the necessary thing we was done to the patient, and patient name and age, and then diagnosis as well. Our main objective, SMART objective, is specific, triage and transfer 5 simulated flood victims to Pantai Hospital Klang. Measurable, all patients categorized, which is red, yellow, green, and transferred within 2 hours. Achieval, utilize available resources like ambulance, first aid kits, oxygen with 5-member team. Relevance will address urgent medical needs and during flood disaster to reduce mobility and mortality. Time bound was complete trial stabilization and transfer between 3 to 5 p.m. same day. Planning phase, our team leader was Dr. Kamil, who is the Chief Medical Officer. So first, he will receive call from Bomba regarding Bukit Tinggi flood patient transfer. Inquire about number of patients and their conditions. Immediately dial 7 and activate code yellow, which is the disaster response, and ensure rapid mobilization of the hospital disaster protocol. Implementation phase. Red zone, which is critical chest injury, agent transfer, and yellow zone was CKD and CCF hypoxemia, which the patient need oxygen support. Green zone is abrasion and bleeding, anxiety, and wound care reassurance. And then after that, we have to update the command center after each zone intervention. So Dr. Kamil giving the briefing lah before we receiving patient. Positive impacts: immediate relief, critical patient transfer, health stabilization, semi-critical patient improve, community confidence, families reassured, psychological comfort, anxiety reduce, skill application, team guide and disaster response experience, command center efficiency, real-time coordination. Okay, we're already in the conclusion. So in the conclusion, what I learned from this activity is ensign welfare, promote medical aid and emotional support for simulated the victims. Collaboration was teamwork and organized planning strengthened disaster response. Command center role, effective coordination ensures smooth patient transfer. Collective action was demonstrated beneficial outcomes and stronger community resilience. Preparedness, equipment healthcare teams for real emergency situation. Okay, one of the feedback my manager was given is, good evening everyone. Today's external disaster drill went smoothly. Thank you so much for your support and well done and good job. From this, what we can learn actually is emergency response training is not providing a recipe, but psychologically preparing the staff to respond efficiently, effectively, and creatively without undue stress. Thank you so much.